Sexuality. Sexuality is one of the most personal area of our life. Each one of us is a sexual being with the preferences and fantasies that may surprise or even sometimes shock us from time to time. Usually these are the part of normal sexual functioning. But when our fantasies or desire begin to affect us or other in unwanted or a harmful way, they begin to qualify as the abnormal one. So today I Bindu Kataria is discussing about the sexual disorders. Before going to the sexual disorders, for the perspective, let's begin by briefly describing about the sexual norm and healthy sexual behavior. Worldwide view of the sexuality is that inhibition of sexual expressions may cause the problems, but previously it was contrast. Consider excess was the culprit. In particular, excessive masturbation in the childhood may cause the sexual problems in the later stage. It was be considered. Over the period of a time, due to certain changes, the attitude, experience, and the behavior of the person toward the sexuality has been influenced. In some of the cultures, society is viewed as an important part of well being and pleasure, whereas in others, it is considered as a procreation. In some cultures or in societies, still the gender who are loving with the same gender person, it is considered as sin and stigmatize those persons. If we talk about the men and the women, men are reported more engaged in the sexual thoughts and behavior than in comparison to the women. For the women, sexual appear more closely to the relationship status and the social norms in that of men's. Now, the sexual response cycle. Many of the researchers had been focusing over the sexual response cycle from a long period of a time, such as Kinsey, Master, and Johnson. Out of them, Master and Johnson had created the revolution by directly observing the person doing masturbation, person getting engaged into the sexual activities. The sexual response cycle, mainly the Kaplan has given the four phases in the human sexual response cycle, which include the desire phase, excitement phase, orgasm phase, and the resolution phase. In desire phase, there is the interest or the desire of person for the sexual arousal, fantasies, or the thought. Excitement phase includes when the men and the women experiences the pleasure and there is increased blood flow to the genital organs and there are certain physiological changes occur in the genital organs of the partners. Orgasm phase, it is followed by the excitement when the pleasure is at the peak level and the person or the partner are enjoying the fullest. Resolution phase is followed after the orgasm phase where there is the relaxation and the sense of well-being and the genitals get relaxed and get back to the normal physiology and anatomy. Now discussing about the sexual disorder, according to ICD-10, the gender disorders, psychological and the behavioral disorders associated with the sexual development and the maturation, disorder of the sexual preferences, which are called paraphilia in DSM, and the sexual dysfunction. These are all the sexual disorders that are classified by ICD-10. Firstly, we'll discuss about the gender identity disorder. If we talk about gender identity disorder, it includes transsexualism, gender identity disorder of the childhood, dual role transvestism, and intersexuality. Now, firstly, we are going to discuss about transsexualism. Transsexualism is that where there is the persistent and significant sense of discomfort regarding one's anatomical sex and feeling that it is inappropriate to one's perceiving gender. Mean here the male guy with his genitalia is not satisfied. Being male, he feel embarrassed, humiliated, and he is not satisfied with his genital organ, penis, or the scrotum, and vice versa. In the female, she is not satisfied with the vagina, cervix, and the mons pubis. The person will be preoccupied with the wish to get rid of one genital organs and the secondary sex characteristics, and to adopt the sex characteristic of the other sex. Here I'll give you an example of a model who is Indian model. His name was Gaurav Arora. He was a male model, but he wasn't satisfied or not feel significant with his male gender. So he transformed himself into the female and got replaced his genital by the female genital organs, and now the Gaurav Arora is known by the name of Gauri Arora, and he is famous in India. That was the example of transsexualism. Next one, if we have to go for the treatment of transsexualism, we can provide counseling to the person to reconcile with the anatomical sex he or she is having, or we can go for SRS surgery, that is the sex reassignment surgery. That was done already. I had explained you in the example. The male model get transformed into the female by his own choice. Next is gender identity disorder of the childhood. It is as same as transsexualism, but the age of the patient is either of the adolescence or teenage or less than 20 year of age. If any one of the patient whose age is less than 20 or he is not satisfied, not feel significant with the genital organs, they are considered in the gender identity disorder of the childhood. Next is the dual role transvestism. It is characterized by wearing the cloth of the opposite sex. Here the person is not significant or satisfied with his genital organs, but he don't want to go under surgery or don't want to change his genitals. He is okay with the genital organs, but he dress up opposite sex like. Means if a male, he don't like to wear the male clothes and he is wearing the female's clothes, that is called dual role transvestism. That is called dual role transvestism. Next is intersexuality. The patient has the gross anatomical or the physiological feature of the other. For example, if the Turner syndrome or the Klinefelter syndrome, if we're talking about these two syndromes, there is a alpha male and the alpha female. Those who are impotent and they are infertile, means they cannot reproduce, these are called as intersexuality patients. Not considering them as a patient, they are the human beings whose genital organs are not defined. That is called intersexuality. Now, next are the psychological and the behavioral disorders associated with the sexual development and maturation. Here it includes the homosexuality. Normally in the culture or in the society, heterosexuality is of importance. Means male can be attracted toward the female or female can be attracted toward the male, vice versa. But if the person who is male and falling in love with the male, that is considered as the homosexuality, means both the partner will be of same sex. And homosexuality is sexual relationship maintained between the person of the same sex, already told you. And In homosexuality, the common terms are used are lesbian and the gay. If the female is in affection or attraction toward the female, the couple will be called, or the girl will be called, lesbian. And if the male is attracted or affectionated toward the male guy, then they are called as gay. If we're talking about the treatment of the homosexuality, we provide them with the behavioral therapy. In behavioral therapy, first the aversion therapy. Aversion therapy, the pleasant response will be replaced with the unpleasant response by making change in the pleasant stimulus. In covert sensitization, what we do, we make the person to realize and imagine the circumstances and consequences of his behavior, and according to these consequences, whatsoever he had imagined, that will result in changing the behavior of the person as that is acceptable in the society. Next is systemic desensitization. To change the feeling of the male guy toward the male guy, or the female toward the female, we will go with the systemic desensitization. Systemic desensitization is step by we are gonna change the behavior of the person. Next is supportive psychotherapy will support the person, or psychoanalytic psychotherapy can be provided to the person with the homosexuality. Next is the disorder of the sexual preferences according to ICD-10, but in DSM-5 they are known as the paraphilia. Now, what is paraphilia? Paraphilia include two words, para and philia. If we talk about para, it is the faulty or the abnormal, and philia mean attraction. So the collective meaning of paraphilia is abnormal attraction. In this kind of a disorder, what happened, the person get aroused or sexually attracted towards someone by the non-human object or non-living objects, children or other non-consenting person, and suffering or humiliation of oneself and others. Means when the person with the paraphilia, he or she may get sexually aroused, may get sexually excited, get the orgasm, get the resolution only when they are in the contact with the non-living things. Either they are getting intercourse or intimated with the children, or taking a person for the humiliation or causing injury to the next person or to the self. In paraphilia, firstly we'll study about the fetishistic disorder. Now, fetishism are the recurrent intense sexual urge, sexually arousing fantasies, or the behavior that involve the use of non-living object, often to the exclusion of all the other stimuli. For example, if a male is with the paraphilia or with the fetishism, he gets sexually aroused by the things like the female's lingerie, shoe of the female, lipstick of the female, cosmetic material of the female. And if a female is with the fetishism, she will get sexually aroused by the article of the opposite sex gender. The disorder is far more common in the men than the women, and usually begin in the adolescence. Next is pedophilia. If we talk about the pedophilia, pedo is driven from the Greek word which means child. Hebe is for the pubescence or the adolescence, and philia is the attraction. Here the patient or the person is attracted toward the children. So pedophilia, in which the person gets sexually aroused, sexually excited toward the person who is of younger age than him, mainly of the pre-adolescent age, or there can be other criteria that the person is of less than 5 years younger than him or her. That is the pedophilia. If we talk about the pedophilic disorder, the criteria for the pedophilic disorder are The person has the fantasies, urge, or the behavior related to the recurrent and intense sexual arousal with having sex with the prepubescent or pubescent children. They get greater or equal sexual arousal by doing the intercourse with the children in comparison to the person or the partner of the same sex. Next is effect on the children of the pedophilia. Persons who is doing sexual activity with the children, it impact the children emotionally and psychologically. Even their behavior get disturbed, there is low self esteem, they start withdrawing themselves from the society, they are not able to interact with other society member with that confidence, there is lacking of the confidence among the children, or increase in the tendency of the anxiety. Person may get anxious or may get afraid of getting in contact with the person of same age. Next is the prevention. For the prevention of the pedophilic disorder, the common element including teaching of the children, in which the person may be taught or the children may be taught for the good touch and bad touch. Next is, for if the person or the child has gone through the pedophilia experience, they should be provided with the cooperative environment, family to be involved in the treatment of them to get back to the normal stage of the person. They should be provided with extra support. Next is voyeurism. If we talk about the voyeurism, it is the sexual disorder or the paraphilia in which person gets sexually aroused or gets sexually excited when he or she see the other people getting engaged into the sexual activities. Means here the person who is getting sexually aroused is not getting directly intimated with others, but he is looking over the other couple or other person who are getting sexually intimated or seeing the next person naked. For example, if a woman is changing her clothes in the washroom, another person who is gazing her from outside getting sexually arouses, that person is with voyeurism. Next is exhibitionism. If we talk about exhibitionism, here the person gets sexually aroused by exposing his or her genitalia. Here the person in the crowded or the public place exhibit his genital organs and get sexually excited. Those persons are considered with the exhibitionism disorder, paraphilia. Now it is voyeurism. It is the most common in the Indian society, where there is a crowd and the person gets sexually aroused, excited by rubbing or touching against the person or the female without her consent. Again, I am repeating, here the person is not known to the next person, but still he or she is rubbing or touching the genital organs of him or her, or rubbing his genital to the next person without the consent of the person. That is called voyeurism. Common example is in the buses, happens lot of time with lot of the women in India. Next is the sexual sadism and the sexual masochism. If talking about the sexual sadism, here the person gets sexually aroused by getting pain or psychological suffering on another. Mean person gets sexually aroused, sexually excited, or get the orgasm only when he harms the next person or his or her partner. That is called sadism. When it comes over the masochism is one when the person get harmed by himself. Means some people get excited or get sexually aroused only when they get injured or get pained by the partners. So masochism and sadism goes spontaneously or opposite to each other. Sadism when person is harming next person and getting the pleasure, and masochism is when the person is harmed by other person and getting pleasure. Next are the etiological factor for the paraphilias. First factor is neurobiological factors. There has been a speculation that androgens play a role. Androgens regulate the sexual desire, and the sexual desires appear to be typically high among people with the paraphilias. Next is the psychological factors. Emphasis classical conditioning as well as deficiencies in social skills that make it difficult for the person to interact normally with other adults. There is limited support for the behavioral risk factors. Exposure to the childhood sexual abuse may be the risk factor. Alcohol use may increases the old acting on the sexual urge. Means cognitive distortion appears to be involved. This can be the etiological factor for the paraphilias. If we talk about the treatment, here again we'll change the behavior of the person by cognitive behavioral therapy or the behavioral therapy, aversion therapy. The pleasant stimulus will be engaged or will be providing the unpleasant response. That thing which previously was providing the pleasant response will be providing the unpleasant response now. That is called aversion therapy. Next is psychoanalysis will be done, and for the drug therapies we will provide the antipsychotic drugs to the person or for the severe aggression in them. Rape is a type of a sexual assault usually involving the sexual intercourse without the consent of the next person, which is initiated by one or more person against another person without the person's consent. The act may be carried out by the physical force, abuse of the authorities, or against a person who is incapable of valid consent, such as one who is unconscious, incapable, or below the legal age of the consent. Next disorders are sexual dysfunction. If we talk about the sexual dysfunctions, are the disorders in which people cannot respond normally in key areas of the sexual functioning. Mean the person is not able to fulfill or not able to complete the normal sex response cycle. Sexual dysfunction are typically very distressing, often causes frustration, guilt, loss of self-esteem, and interpersonal problems among the couple. In sexual dysfunctioning, first is the frigidity. Frigidity is the absence of the desire for sexual activity. The person don't have desire to have the sexual activities. That may cause interpersonal conflict between the partners. Next is impotence. In impotence, it is inability of the person male to maintain the erection of the penis or satisfy the female's sexual desire or sexual orgasm. Next is premature ejaculation. In premature ejaculation, before the satisfaction of the female, before getting at the stage of the orgasm, there will be ejaculation of the semen, which resulting into the frustration and couple distortion. Next is non-organic vaginism. It is an involuntary spasm of lower one-third vagina interfere with the coitus. Next is the non-organic dyspareunia. Dyspareunia is the term which means having pain during intercourse either in the male or the female. That is called dyspareunia. So these were the sexual dysfunction disorders. If we talk about the etiological factors, the etiological factors for the sexual dysfunction are biological factors. If there are decrease or imbalance in the hormones, that may causes the sexual dysfunction. Psychological factors, if the person is stressed, there are more chances of having premature ejaculation. Too tired model is also there for the etiological factors of sexual dysfunction. Next is the treatment. For the treatment, the couple therapy can be provided. Anxiety reduction therapy is to be provided to reduce down the anxiety, frustration, humiliation in the partner or in the person. Direct masturbation to be taught to the person so that the pineal erection or the control over the semen ejaculation can be taught to the person. Change in the attitude and the thought of the person to reduce down the stress of the person and be normal. Next is skill and communication training, in which the person or the couple are taught to have the proper communication skill. If someone having problem, that should be communicated to the next person. Next is the medical management. In medical management, SSRIs can be provided to prevent the depression. Squeezing technique. In squeezing technique, it is for the premature ejaculation. In premature ejaculation, when the person get the feel that the semen is to be ejaculated soon, he will pressurize the penis by the two fingers so that the semen ejaculation to be stopped and there will be no ejaculation prior to the time of the orgasm. That is the squeezing technique. Here are the nursing intervention for the client with the sexual disorder. When a nurse is dealing with the person with the sexual disorder, what she has to do? Firstly, assess the patient's sexual history, previous level of satisfaction in the sexual relationship, and she should also assess the perception of the person toward the problem, how he think of the problem. The nurse should know about the cultural, social, ethnic, racial, religious factor that may also hinder or affect the sexual functioning of the person. Assess for the medication which might affect the libido. There are certain drugs which increases the libido or certain drugs that decreases the libido. So nurse should be known of these medicines if a person is taking that medicines. Provide information regarding the sexuality and the sexual function. Correct the misconception if any misconception is there and they require and there is a necessity to correct that misconception. The nurse will teach the patient that sexuality is a normal human response and that involve a complex interrelationship among oneself and body imaging, family and the cultural influences. Both the patient and his partner may need the additional assistance in the bed activity. So they should be provided with the proper sexual education. Refer for the additional counseling or the sex therapy if it is required. Assist the therapist in providing the psychotherapy to the couple. So these all are the nursing intervention for the patient with the sexual disorders. So today we had studied about the sexual disorder, normal sexual response cycle, which include desire, excitement, then the orgasm and then resolution. Then we had studied that ICD-10 had classified the sexual disorder in 4, that is gender identity disorder, psychological and the behavioral disorder, disorder of a sexual preference and sexual dysfunctioning. Then we had discussed one by one in gender identity disorder, transsexualism, gender identity disorder in the child, dual role transvestism, intersexuality, then the homosexuality, and then we had discussed the certain type of paraphilias. So that was today's topic. Thank you. That's all.